Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
Could a tiny bite from an animal become deadly? How long can rabies hide? Why is treatment so sensitive? Good day and welcome to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. Today we're discussing one of the world's oldest and feared infectious diseases, rabies. Although it may be rare in the United States, thanks to vaccination programs, thousands of people worldwide still die from this disease every year, even here in the United States. The tragedy is that nearly every one of these deaths is preventable. Doesn't mean all, but it is nearly. So today we're going to explain how rabies spreads, the warning signs, why immediate treatment is essential, modern vaccines and research, animal prevention, global statistics as well, and new scientific research. Let's touch base a little bit on those topics just to give you, you want to stay to the end of the show, by the way, because this seems to be an epidemic in McHenry County in Illinois right now. And it is also in other areas. They're just not advertising it. So rabies is spread through the saliva of an infected animal, most commonly by a bite of sort. Sometimes not. Just the saliva being on something and touching it can go through your skin. It's a virus. It travels through the body's nerves and into the brain. That's the scary part, where it can cause severe inflammation and neurological damage. So warning signs, early symptoms often resemble the flu and may include fever, headache, fatigue, and tingling or pain near the bite. As the virus reaches the brain, symptoms can progress to confusion, difficulty swallowing, muscle spasms, paralysis, and even coma if left untreated. By the way, when you start to get the symptoms, guess what? They can no longer give you the shots. So this is why our title today is Rabies Signs, Symptoms, Vaccines, and Saving Lives. And we'll get more of that into that as we move on, as we progress here on the show. Why immediate treatment is essential. Once rabies symptoms do appear, it's almost always fatal. There's some new research we will mention. By the way, we have a guest here on our show today from the Holistic Nurse with Peggy Smith. Peggy, are you here?
I am, yes. Well, thank you.
You're there. Okay. Yeah. We're going to discuss a little, just touch base on modern vaccines. You don't take the vaccine in your stomach anymore. Isn't that true?
That's what I had heard. I'm very grateful to hear that because here in Pennsylvania, just like in your area, there is a lot of that going around. And
right.
That's one of the reasons some people don't want to report if it's a family dog or something,
Mm-hmm. No longer vaccines in the stomach either. So, and there are some tricks to whenever you receive any vaccine, especially a child, so that they don't feel the pain of the vaccine. And I do that with acupressure for myself. And when I used to work in laboratories and have to stick a lot of people and set IVs, it really helps for any age. The vaccines today, though, the purpose is they stimulate the immune system to produce protective antibodies that hopefully will neutralize the virus before it can cause disease. Notice I said before it causes disease. Just like I said, if you already have the disease, these inoculations here are not going to help you. So let's talk a little about animal prevention, because a lot of times rabies comes from animals, right? I could think of a few. Could you, Peggy?
Uh, I can, and like everybody, most people knew that if you saw a raccoon in the middle of the at noon, that they probably had rabies because they don't come out in the daytime. But I've recently learned of some other animals that I did not expect to be, you know, either out in the
Problem?
daytime or, actually carriers, and anybody can be a
Mm,
carrier.
yeah. Somebody told me possums don't get rabies, but I remember caging a possum and it acted like it was rabid. I mean, it had foam coming from its mouth, and I don't know the answer to that. Maybe that's something for future research, but I think I'm not going to take the chance. You know, when in doubt, avoid. So, responsible pet ownerships, though, has dramatically decreased human rabies cases in many countries. So, in global statistics, rabies causes an estimate of about 59,000 human deaths each year worldwide. That is human deaths. You know, and that's something they don't talk about. I don't think I've heard anything about that until a couple weeks ago when I got bit. How about you? It's like not heard
Uh,
of, right?
well, is that in civilized, so-called civilized countries, or is this in more rural areas?
That's worldwide.
Because
I think
I
it's
know
probably
in
higher, but
metropolitan areas they have so many rules and licensing requirements and things like that. And even if
right.
your dog is you prove that you've had the shots and everything, they still quarantine them uh, to make
Yeah.
sure that which is very distressing. It's you just can't you never should probably just let your dog out without watching it. uh, but
Hmm.
it's even more important now is responsible pet ownership.
Yeah, and that takes into account too that we're talking about animals that are pets that can be vaccinated for rabies each year or every 3 years. They have the 3 year shot out there now. But that doesn't include wild animals. Oh, Mr. Cutesy Raccoon out there or bats like are out here. I mean,
Well, I
there's
always thought bats were cute too until you shared your experience.
put up bat houses, increase the population. Well, guess what? Yeah, something to consider. You know. But yeah, from wild animals they can come from, and even if you're just one brushes up against you, you need to see it. So you go to the emergency room and have them look at it, and they may want to take the precautionary measure after speaking with you and trying to figure out if you need that. Leave that up to the professionals. Let them guide you as to what needs to be done. That's not something that you want to try treating holistically as well. I have not found any information on holistic remedies to treat rabies that is completely effective. So it's best just to get the shots. And I got the shots a couple weeks ago. They really were not that bad, and it's well worth it. It's not to say the shot works 100% of the time. It helps to prevent it almost all the time, but there may be one person here and there where it wouldn't help, and that's if you're immunocompromised or something of that nature. But on the brighter side, research has developed faster diagnostic tests, improved antibody treatments, and more effective vaccines to expand protective protection worldwide. You know, this is something to consider too. I think we talk about this at the end in quarter 3, where we discuss all the new emerging research that has come out in the last year. It's phenomenal, and it doesn't mean that we have access to this. It means the research was done and it proved to be effective, but uh, general public it may not be available to. So, and scientists are also using genomic sequencing and artificial intelligence to better track rabies outbreaks. Future
Since
vaccine
you're in
technology.
more of a rural area than I am,
Yeah,
and this is a public health problem. Did you find that the necessary uh, treatments and everything were covered by municipalities and state or something, or it was just something that had to go on your insurance? And
I think it goes on your insurance. Um, and for those of you out there with public aid insurance, I'm just letting you know, emergency rooms, really that's where you need to go, and that is covered by public aid, and that most of the time is a federal situation because they don't want it to spread. You can pass it on if you have rabies of any sort, just like an animal would. So it is
How does
covered
human, excuse
at
me
this
for
time.
asking, it might be a dumb
Mhm.
question, but how does a human pass this on?
Saliva, the same way any animal. Saliva, or I mean, if I was licking my hand and then touched somebody, just like an animal, but I'm not going to be doing that. But it's a virus, and viruses usually can be passed on from surfaces, just like other viruses which we've experienced in the recent past. So it's not a matter of taking precautionary measures. It's not like if I get a symptom, I'll go in. It's too late. They won't give it to you. They won't give you the vaccines. If you have one symptom, they won't give you vaccines. When you get bit, you need to go in ASAP. You got a shopping cart filled with stuff, fine. Cash out, go straight to the emergency room, have somebody else pick up your groceries. You need to start the sooner the better. And that they did prove the sooner you started on the shots, most likely it would work more often or not than not. So we really just need to take this as a serious thing, and sometimes you don't know if you've been exposed either. And that's another question and problem that we are going to address shortly. In the case of me and my bat bite, you don't feel bats biting. They're not painful. They don't swell up like a mosquito bite. And that's another thing. Bat bites, you have two little tiny dots next to each other. Guess what? It doesn't swell up. It doesn't itch. You get these lumps and everything from these big, huge, you know, monster mosquitoes that are biting us, but you get nothing from a bat bite at that time. So, and there's reasons for that, which I'll go into later. Um, I don't know. Have you ever been bitten by anything?
I have, but they were all vaccinated when, when they bit me. Obviously, working with
Oh, thank
rescues and all,
thank
I'm
goodness
going
for
to get
that.
bit from time to time. But
Yeah.
you know, it it brings up a good point because sometimes 2 days later, oh, how did I get that scratch, or what happened here? Where'd this bruise
Yes.
come from? So if it's that insidious, how do you know? Like, how did you know? Did you see the bat fly away, or
Hmm. Yeah, and about the scratch. No, I did not. I did not. All I know is I was taking care of my chickens, and going in and out of the pen, and I went to pull the canvas down over their pen. Their coop is inside the pen, but I went and pulled it down, and it was like I had a I don't know, a bird or so, I don't know. I just went like this, and it was furry, but I looked, there was nothing there. I finished doing what I was doing. I came inside, and I had like a blood smear from going like this, you know. And I was like, I was like, oh, son of a gun. And being an epidemiologist, I know what a bat bite looks like. I'm like, son of a gun, get bit by a bat. So,
I've always thought bats were really cute, and actually, I just remembered
mhm.
I had a couple times where I encountered one, and I was holding it in the palm of my hand, say, "Oh, how cute!" How do you say?
Ooh. Oh, bad girl. Don't do that again. Yeah, I actually set up the bird, bat, and butterfly gardens and did the training program for all the Chicago Park District supervisors so that they could do their bird, bat, and butterfly gardens. And then I assisted with setting up everything for the first one. And, it's wonderful. Bats, they eat anywhere between 10 and 20,000 insects every night flying through the air. I'm on the water. I don't have many mosquitoes because of the bats, but unfortunately, too many bats and now some rabid bats. So you don't take a chance though. If you don't know, be safe, save your own life, and go to the emergency room, get the help you need. Children, with 4th of July weekend out or days, and then when they're outside, especially at dusk for the 4th of July fireworks, big concern, big concern. Especially with the heat for us. Eh, Kids could get bit and you would never know. You need to check your kids over when you get home, just like you would for a tick. You check them over for a tick if you've been in the woods. Check them over for a bat bite. Two little tiny holes. They love biting the head, and they love biting any part that's exposed. So it's something to consider. But even the scratch of a dog, if you don't know if it had its shots, go to the emergency room. Be safe. they'll have a police officer go there and check. We're going to take a commercial break here, and when we come back, you're going to love this, we will discuss signs, symptoms of rabies. We'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Welcome back. So, today we're discussing rabies, signs, symptoms, vaccines, and saving lives. So let's look at the signs and symptoms. We talked about like different animals and whatnot, but let's talk about humans for a minute. Usually the incubation period usually is 1 to 3 months, but it can be several days up or more, even up to a year, depending on the bite location, the amount of virus that is in the person, and the distance to the brain. This is something to consider. Early symptoms are fever, headache, fatigue, weakness, pain at bite site. I had no pain. It turns out I have like 5 bites on me. So, yeah. So, but I didn't have any pain at the site, but I took all the precautionary measures, and it doesn't mean there wasn't rabies in that bite. It just means my body didn't react as if there was. Tingling, burning, numbness, progressive symptoms are confusion, anxiety. Boy, I don't know. Hallucinations, difficulty swallowing, hydrophobia. It's the pure fear or painful spasms when trying to drink water. So aerophobia is painful spasms triggered by moving air, like if the breeze comes on your face. Those are 2 real symptoms. Muscle spasms, aggressive behavior in some patients, paralysis, and coma and death. But, do you know anyone that has had rabies at all, Peggy?
Not in my recent adult life, and people I have it came from stray dog bites and things like that. But I've been in different caverns, the tourist caverns that you go in and on tours, and there's always bats. The guide's always showing us, look at the cute little bats, and
Mm.
there's no way you can inoculate the bats to keep them from spreading the disease.
No. Yeah, that's a good point. You can inoculate, let's say it's coyotes that are carrying it, raccoons, skunks, or whatever, simply by putting out bait that has the inoculation in there. You put enough of it out, and eventually they're all inoculated around you. Bats, it's not the same. If you put something out for a bat, the birds are all going to want to eat it too. Pretty much they eat a lot of the same things. So there is a problem too. How do you get the bat count down without killing other animals? There's severe problems with this whole thing. You can't.
Well, I mean, if
I
you got bit by the chicken coop, couldn't your chickens have been bit? This is like who came first,
It's
the chicken or the egg?
possible. I'm not sure if they bite birds.
Would
I'm not
I'm
sure.
curious if they would be if the chickens were also bit. It's likely they were.
They seem to be fine though. So, but good
But if
question.
do they can they pass the rabies virus in their eggs?
That's a
I'm
good
giving you all
question
kinds of
too. I think
homework.
I need to do some research here. um, yeah, I do know that they're medicated quite often, and just as a precautionary situation with them, I medicate them for worms and viruses and things of that nature, but that doesn't mean it's perfect. Usually their eggs are put in a separate container, and then after a couple of weeks, that's when I move them for the next batch to be eaten. So I think still within that time frame. I will double check, see if there's any research out there, and if anyone would like to leave me a comment, I'll remember to comment back on it, and I can tell you what the research is.
There may be
Um,
viewers that even know the answer to that, have
mhm.
experience with them.
There's progressive symptoms too, confusion, anxiety, hallucinations, and I think we just went through that. So as far as furious rabies, it's most recognizable, when you see agitation, these other huge symptoms, fear of air, breeze and water, and aggression. And then there's paralytic. Am I saying that right? Paralytic. Yeah.
Yes.
It happens gradually when you become paralyzed, less dramatic, often mistaken for other neurological disorders. There's a ton of research on this, a huge amount of research. Um, yeah, I think we went through some of this, but the research itself has come out where new advancements actually in research for not just the intervention, but rabies infections uh, can be managed effectively. Challenging the long-held belief of rabies is invariably fatal once clinical symptoms manifest. So there again, you would need to be treated before you get any symptoms. And that seems to be something that I have a hard time telling people here about. They don't understand. We had a gentleman in this county that passed away a couple months ago, even because, and a couple years ago, another man died. The thing is, oh, when I start feeling sick, I'll go in. It doesn't work that way. Once you get a symptom, they can no longer give you the rabies shots. So
Well,
now
I
there are
know
some other.
you're focused because you're in a more rural area than I am, and I'm thinking, and I rescue animals, so many people think you have a fenced-in yard, you can just let the dog, you can be lazy and not walk your dogs, and when they start
Mm,
barking, you bring them in. But we had an experience last year in this area where someone let their Yorkie out in the backyard, who doesn't, they don't usually stay out a long time. She looked in her kitchen window, literally had just closed the back door and looked in out the window, and a coyote had picked up the
oh,
Yorkie, and
oh,
that was the end of that. So
hmm,
it's a whole new perspective, and it's not the same world maybe that our grandparents were in.
right,
If a dog,
right.
if your domestic animal has the rabies shots, does that mean that if they got bit, they won't get it, or they won't get it as bad, or they could still pass it on to you?
Well, if
I'm
the
learning as much
animal
as
has
you.
been inoculated, then most likely they won't get the rabies. um, because they build an immunity towards it. Now, that doesn't mean you're not a carrier. Rabies, you can be a carrier. So if you need to be, you should get tested just to be sure. But they're not going to come up with a positive results of rabies if you just got bit. It won't, 2 months
I
to a
know
year,
some
and even
areas require, if it's a domestic animal up to date on his shots, they just sit
right.
quarantine like 14 days. If you don't know if the animal's had his shots, it could be a couple months or even put down, if there were any symptoms at all showing later. Um, so,
Absolutely.
and people love their pets, so
Yeah.
it's really is an issue that
Keep them
that's
safe.
more
Also,
often than they think.
right. And also, we have our tiny dog, who's like 8 pounds. We have a coyote vest on her with these big, big stringy things of plastic that stick up. and it's a Kevlar vest that you put on. It covers her whole back and even rump, and wraps around her, and it's got the pricklies so that a hawk won't can't isn't as easily it can't easily grab them unless they grab them from like their head. But the
Mm.
hawk is deterred, and then the coyotes are deterred because they go to bite and they get stuck with these prongs, and then there's steel spikes coming out too that are like an inch and a half long. So because we have coyotes and everything here, we have to take good care of our little baby. So
Well, I'm thinking that my little babies would be injured by that a vest like that because I can barely keep their, walking vest on just long enough for a walk without
uh,
them biting it off, and that may not work
right.
in my household.
Yeah, she's used to a vest. Ours is because she's a service dog. So there's a difference. But yeah, absolutely understandable. Um, it's scary though when you think that they can get picked up by just about anything. Once I had this huge hog. I mean, must have been 2.5 feet tall, sitting on the chicken run, and I'm like, oh my God. And he was like, what? What do you want? What do you think you're going to do about me? It's like, oh my gosh, thank goodness they were in cage. So I didn't bother with anything, of course, but really surprised how big those animals are too. So,
And they have
um,
amazing too. They can see, a field mouse from hundreds of feet up in the sky.
yes, yeah, yeah, they really have that vision. I really wish I could have that vision. That would be wonderful. One more point I do want to make out before we take the next commercial break. Some of these neurological disorders could be misdiagnosed as something else. So that's another good reason why when you go somewhere outdoors, like I said, please check yourself over and have somebody check your scalp. And just like you were looking for a tick, and you just two tiny needle-like holes that are that tiny. You can barely see them, but they're there and they're close together, but not even half an inch, maybe a centimeter, not even a centimeter sometimes, depends on how big the bat is. So do check each other over. And I'm concerned because I don't know if anyone is going to come up with problems later after the 4th of July weekend. Think Labor Day, anytime you're out for a picnic. I got bit every time in the daytime. So that's a sign that maybe something's not right with these bats. That's a sign that they
I,
may be
I
well.
had heard that their light and darkness, schedules are off when they have rabies, and that's why if you see a raccoon
Exactly.
in the middle of the day, you know that they're probably rabid. But
Right.
I wonder if you shone bright lights over the chicken area, would that keep them away? I mean, bats usually live
We
in
have,
dark.
well, we have sensor lights, but I think the biggest thing was I had a canvas over the pen, and I had somebody else put the canvas up in the mornings for me for like a week, and they were doing it like 6 a.m. when it was still like dawn, and most of the bats don't go away until after dawn. They quickly go away before it's bright light, but it's one of those things. And I think pulling it down in the evening, maybe there was a bat in it each time, or maybe they've been scurrying there because that's the only place to go to real fast. And maybe I was irritating the bats. I have no clue. It's one of those things. But yesterday I went with a hood up inside the pen, and a bat attacked me during the day, and there was no canvas. So who knows? Who knows?
Well, we'll take a break
Well,
right now and,
yeah.
breather, and we'll be right back.
When we get back, though, how rabies is diagnosed, treated, and even more information that you won't want to miss. We'll be right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back to Medical Intuitive Insights. We are discussing rabies, signs, symptoms, vaccines, and saving lives. By the way, if you like our show, please give us a thumbs up, press, share it, and subscribe. It keeps us going to bring this very important information to the public for free. Thank you. So let's talk about diagnosis a little bit more in depth and treatment and how doctors actually diagnose rabies. That's something that is very particular. I mean, there's nothing really completely like it. So first, they're going to look at the patient history, which I'm sure you're used to that, Peggy, and then animal exposure and all the questions, and then some. I think there were 3 separate people asking me last time I went in the emergency room about all the questions, and then, it can get a little sticky, so to speak. Are you sure they're not in your house? I must have heard that 3 times, one from each. I'm like, no, they're not in my house. I live on a nature preserve next to a woods with a marshland behind me. Okay. It's just, it's just what you got to go through. Just do it, get it over with. Sometimes they can do a skin biopsy. I opted for the shots. I think it's simpler, but who knows? I mean, this is as most they can do right now, especially since the research in the monoclonal antibodies research, they don't have that out for the general public yet. Saliva, PCR, like I said, what are they going to do right now? Blood testing, same thing, but it's there in case you're starting to show symptoms. They want to verify it, make sure. They have to do process of elimination. Maybe you're becoming erotic because of something else. Maybe you're getting a brain tumor. Who knows? They got to rule it out, right, Peggy?
Right, and I know our area of the country takes it very seriously. A couple years ago, um, I'd been bitten by a new rescue, but the rescues were all up to date before they come to me. And I went over, I think, to urgent care just to get the Augmentin because it was a dog bite, the dirty bites, regardless.
Right.
But I was surprised that I actually had people coming to my door to see the papers after 2 weeks after I was in. Like, how did you know? It's my dog. Yeah, it's my dog now, temporarily at least. And but yeah, yeah. So they're watching it.
Mhm.
I think the emergency people are mandated reporters. They have to say, and many people, especially if it's a family animal, especially if it's one of the high risk animals that I do love, but you're worried, and some of it's misconceptions. They don't just come in and take your animal away, but they do want to make sure that you're being responsible, making sure nobody else is at risk. That's their job.
I do appreciate that, though. And just so everyone knows, it's good that they are doing that for accountability's sake, because if you were bit and you turn out getting rabies, they have to test everybody in the household, people you've come in contact with. I mean, it spreads quite easily. So it's good that they're doing their
It also
accountability.
protects you from liability because say your
Right.
dog bit a neighbor, and if someone didn't come to make sure you had that, your neighbor could sue you for giving them rabies, and you can prove that it wasn't your dog. You have all the
Right,
documentation.
right. How true is that? They can also do spinal fluid testing, brain imaging testing, lab confirmations. By the way, um, here in the United States, they give you those shots. Of course, if you have no symptoms yet, they'll give you those shots. But other countries may do it differently. Like down in Mexico, they actually give you the same shots, but they give it in the spinal column.
Ooh.
So it gets directly in the spinal fluid. Well, no, there was a research study done, oh gosh, it must have been 10 years ago. And they actually found that any type of brain infection or whatever, if they give the antibiotics right into the spinal cord, by the spinal cord, that it actually has much huge different numbers, much
For
better chance of
encephalitis and things,
curing it.
that's what they do.
Right,
Yes.
right. So there is a purpose for that, and they want to target it right away. Of course, I don't know, maybe rabies is more lethal down there. I'm not sure, but that's something else to look into. Brain imaging can help too for confirmation of rabies, and lab confirmation, if they did a biopsy or blood test. So immediate first aid, and I have to stress this, wash the wound with iodine, providone iodine, right away, even before you go into the hospital. As soon as
And
you
that's
can wash it,
commonly
the
known
better
as
off.
betadine, in case people don't know.
Yeah, or even
Betadine.
with soap and water if that's all you have. As soon as you wash it, the better your chances are. Um, at least 15 minutes, and then apply antiseptics like uh, hydrogen peroxide. Let it bubble it out a bit. Me personally. I'm a little. I'll spray peroxide and like scrub it in and peroxide. I'm just a little over the top, but that's just me.
Well, you
And then
also
go to
don't
the
want to
emergency
put an
room.
occlusive dressing over it. You need to have air because it's kind of an anaerobic bacteria that will just fester, and the gases and everything will get into your bloodstream quicker if it is a bad bite.
Right. And then there's post-exposure treatment. This is after you're treated. They call it a PEP or post-exposure prophylaxis. It entails a rabies immunoglobulin shot, which they actually give you at the site. And the needle is so thin you don't even feel it. They give it to you like several times. They go in at the site and they make sure they get all the tissue, some of that in there. I did some acupressure up here at where my bone is, and I didn't feel not one thing. She even stopped. She goes, "Oh, you're doing so well. I can't believe this." And I said, "No, I got doing a little acupressure. I don't even feel you." Wonderful. Not to say it always works, but I think it's the size of their needle. They're using a really fine needle. Then there's the rabies vaccine, of course, and multiple vaccine doses over a 2-week period. When started before symptoms appear, the PEP is highly effective in preventing disease. So once symptoms begin, this is the real nitty gritty, right to the point. Unfortunately, the traditional belief is that there is currently no consistently effective cure. But like I said, there's new research that came out recently, and that is the monoclonal antibodies suggested specifically the F11 antibody could neutralize the rabies virus and prevent infections in humans. Single dose therapy, they just came out with in the lab. I'm not saying with the public yet, but this study was published by EMBO, Molecular Medicine, indicates that a new single dose monoclonal antibiotic therapy may effectively treat rabies symptoms. A combination combining T cell immunogens with virus neutralizing antibodies has shown potential in enhancing the immune response against rabies. So there are a few other things that are against the traditional belief, but actually could help maybe after symptoms begin. So they're having a lot of positive uh, results in that. So this is something that's absolutely wonderful. I'm just so grateful. Unfortunately, I don't qualify for that. So yeah, that's something else to look at. How valuable is our lives? I know mine's pretty valuable with everybody who relies on me for what they need and what I do for the public. So I'm hopeful. There is no 100% cure, but I am hopeful and I am going for the best. I'm also doing some natural things as well. So I don't
Well, I
know.
think hydration, I have to bring this up. Hydration is something that will help alleviate symptoms. It'll help you tolerate the side effects
Yeah.
of both the disease and the injections, um, and just make you all around healthier person. Uh,
Yeah. So those strong, overpowering people out there that can think they can do anything, don't think you're going to stay home though and wait till you get start getting sick. It's too late if that's the case. So there is no such thing with rabies. If you know some kids that have been out, mention to their parents, by the way, you may want to check them for bad bites and ticks while you're at it. Check for both. You're right there. You might as well do both. Um, I don't know. I'm so grateful for everything, but this symptomatic rabies in humans we might be able to treat now, but not at the public mass level. And hopefully they'll get that information and all the virus type of antivirals out there that they just discovered out to the public quickly. I mean, my goodness, that's like smallpox vaccine,
well, I
Where
mean,
were you last year?
the just hours of work and increased medical bills and all. It's a real issue for society.
Yeah, yeah. I do know my emergency room told me that don't worry if you're here in the emergency room, it's covered 100%. So I was grateful to hear that. I think it's because it's considered a public health situation and they treat one for the sake of all. And that I'm pretty sure that's most likely what it is. So, and the problem too is if you wait for those symptoms, some of those symptoms be like, oh my gosh, George just didn't take his meds, no person intended, but you know what I'm saying, that it could be considered a regular psychological situation or um, whatever. It's not good. Um, it's hard to diagnose it, especially if people don't know what's going on.
Well, we tend to, have high anxiety about things we don't understand, especially if you're not aware that you got bit, and then you're embarrassed about, they'll just think I'm a, hypochondriac, or, it's that I'm not really sick because I can't describe the symptoms properly. That's one situation you're in doubt about anything. It's better to
Hmm.
be relieved that they said no, there's nothing wrong, uh, than to wait until the symptoms can't be reversed.
Right, right. And you got to remember too that just because we mention like animals that may carry it, like bats, raccoons, foxes, skunks, monkeys, doesn't mean that any animal would or would not carry it. There's other animals out there that may very well have it. So we are just touching bases on certain animals, and whenever in contact with an animal that you don't know anything about, you're better to be safe than sorry. Don't go out there petting wild animals, people. Don't go out there petting deer and things like that. A deer can kill people with just one kick, and people don't realize. I have deer walking up to me often, and I just quietly step back. and, um, Animals can be dangerous, especially wild animals. They are unpredictable in spite of what people may think. And maybe some animals that are used to human beings, they actually maybe a little more predictable, but it's like if you raised something from a pup or whatever, but still there's wild animal instincts that you don't always know if that they're going to be predictable. So please stay away from wild animals. It's not what you or anybody should be doing, especially in today's age. Even if they come up with a rabies um, vaccine, that's going to be a one-shot vaccine. By the way, that's the thing. It's a one-shot vaccine that they're working on right now. So not all these other shots. And like I said, thank goodness the nurses are so nice. So we're going to take our last break, but you won't want to miss this final segment of our show. Please like, share, subscribe so we can keep this information coming to you. And we are going to be talking about recognizing bites and scratches and things of that nature, as well as prevention, vaccines, and more future research. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. We have Nurse Peggy Smith from the Holistic Nurse with Peggy Smith on with us here. And it's always such a delight, Peggy. I do appreciate this,
Well, this has been
hearing your
special
wisdom.
because I'm learning as much as the viewers, but I'm hoping I'm asking questions that other people might be thinking while they're watching you.
Right. And if you have any other questions you want to ask, please, that's what the comments section is for. I can pull on Nurse Peggy here. She doesn't mind. We can both, brainstorm, give you some answers or some research even, and even, check with other people as well that are in the medical realm. So, yeah, let's just do a little bit about public health tips. Prevention, vaccines, and research are added to that as well. Public health tips. Well, covering your body is one of the best tips I can give you. Sprays, sometimes there's a little debate. Does DEET actually help, ward off bats? Well, they have a very keen sense of smell. So I would think that they would help. It doesn't mean 100%, but even with other animals, sometimes the scent is something they don't like. So, and keep in mind that it's not just at nighttime that these animals come out. I know we've had coyotes and we've had skunks come out in the daytime. Skunks come out in the day at sunset before it gets dark. So that's like their best time. They're hungry. They're out before anyone else of the night nocturnal animals. So, but that doesn't mean that's the only time they come out. So
Are
how do we
badgers one of the animals to look out after, worry about? Because sometimes, you do see them in the daytime. I'm just curious.
Yeah, that's a question for me, right?
Yes.
What were the first few words you said? I think I was
Are
yeah,
badgers something that we should, could be carriers? Or do they
yeah.
stay away from people? Or
No, we actually had a badger buddy here. They're out and they're extreme. Some of these animals can be very mean. We actually had a mink too, and we've had bear in our yard. We've had just about every animal. A mountain lion we've had in our yard. I mean, we've had just about every animal known to the United States, anyways. So badgers, beavers, any type of animal in that scenario can become vicious when they want to be. So you're better you can sit there and talk, keep a safe distance, like 20 feet, And you can talk to them. Try not to feed wild animals because they're going to set up camp wherever you feed them, and you don't want to be setting up camp by your back door, or under your porch or in your attic. So that's something to really be careful with. I let nature take its course, and the only thing I feed outside are my chickens, and that's my choice. Not, I keep all the chicken food where any other vermin cannot get to it. I think there may be an occasional chipmunk though that weasels in there and gets some of it. So, this bit about checking everybody over when you had a wonderful day out in the sun or whatever. What do you actually look for other than those very tiny little holes? Um, Bats do have tiny sharp teeth. They're like needles, and that's why they're tiny little holes. It may feel like a pinprick. Most of the time, it's never noticed even. Possible sign are those puncture marks. Only a few millimeters apart is the way the research terms it, and that sounds about right. A small scratch or superficial cut from a bat claw can actually, if they have rabies, can actually give you rabies, and you never want to take that chance. It's like saying, oh, do I want to live today? Well, maybe not. Okay, I'll take that chance. So don't take that chance. We're going to keep stressing it. Minimal bleeding or none at all. I had bleeding from 2 of the bites, and that's the only reason why I knew that they bit me. I mean, thank goodness I had a smear of blood when I brushed something away. I'm wondering, what the heck is that blood? Oh my gosh, it's a bat bite. It's very typical. Look online, you'll see what the bat bites look like. They're very unique. Slight swelling or itching or nothing at all. So most of the time, I don't get any symptom from a bat bite. So why are they missed? Just because of that. You don't feel them mostly, and they weigh less than an ounce. You heard me right. They're not like half a pound. They're less than an ounce in weight. They can land on you and bite you and leave, and you would never even know. Teeth extremely fine, sharp. Bite may occur while a person's sleeping, camping, or handling an injured bat. Please don't do that. You want to catch it and put it in a shoebox with a few holes on it and take it to a rescue facility. They know better how to deal with that and check it for rabies and all of that before they handle it. So please don't just think you're going to pick up a bat or any injured animal and take care of it yourself. Not
So,
smart.
Gloria, I just thought, most wild animals stay away
Mhm.
from us. They've got their world and we have our world. So, if an animal's exhibiting atypical behavior, as in they're coming up to give you a hug and everything, would that be a sign maybe that they've got something going on inside their brain and they're acting abnormal?
It is actually, because wild animals usually don't come near people. They stand clear, they stay away, unless they're protecting their young or something like that. I mean, you have to assess the situation when you're there. I had a possum clawing on my screen one night, and I'm like, oh, this is great. I'm going to scare him away. I want to keep the possums because they eat all the ticks. So I wanted to scare him away. I took a stick and banged it on the side of my door jam or whatever, and then I opened it up and hit it on, and he walked away, and I said, go, go, and you make a lot of loud noises, and I don't know, just trying to get it to go. So who knows? I just think that we just need to be extra careful on that situation. And anyways, though, thank you so much for joining us, Peggy. I do appreciate it.
Well, thank you. I'll send you some Reiki and hope that you recover quickly,
I
uneventfully,
appreciate
and
all the
stay
help I
hydrated.
can get.
Stay hydrated.
Well, thank you for joining us here today for another episode of Medical Intuitive Insights. Knowledge truly is one of the most powerful forms of prevention. It can save lives. By understanding signs and symptoms of rabies and knowing when to seek care and actually going to receive care, you could help protect yourself, a loved one, and even save their life. I'm Dr. Gloria Warren. I encourage you to stay informed, stay healthy, and continue to explore incredible connections between science, nature, and lifelong wellness. There, but for the grace of God, go I. Until next time, take care of yourself and each other. Good day.
Have a great week.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.